here's what we're proposing to address some of those anxieties, provide more clarification, and really try to lean in to the future and anticipation. Again, we're seeing light at the end of the tunnel. We're confident in our ability to move through this pandemic and the challenges in front of us, particularly in the next 30 to 60 days, but really looking at the spring, looking at, beginning February, March, April, where are we going to be, and how can we assert more clarity, more focus, and really create an establishment of expectation relating to, again, our default of safely bringing our kids back in person learning, back into the classroom for all of those social and emotional benefits. Here's the plan: phased in person learning strategy that would focus disproportionately on those youngest cohorts and those that are most in need, our high-risk children, special education, those populations, foster care, homeless children, and others that clearly need that extra amount of support. So the idea is to begin TK-26 with special ed and populations, as we note here, that have been disproportionately impacted by this pandemic, but also more broadly are disproportionately impacted by a series of issues that are well defined in this state. We also want to improve our efforts to get everybody moving in a similar direction to be back on track across the spectrum by early spring of 2021. Now, distance learning, I'm going to make this clear, will still remain an option for parents and students. And there's a lot of trepidation, we recognize that, a lot of anxiety about going back into the classroom, which one has to clearly acknowledge, not just for our teachers, but also for our parents, particularly with kids that may have unique conditions that may not make that ideal. And so we want to maintain the ability to continue to get the learning that you've been receiving as it relates to that distance learning. Elementary schools can open, but only if they submit a safety plan to both local and state officials. And so this is the new guidelines that we'll be putting out. Local health departments can disapprove. So rather having a default of no, it's a default of yes. You can disapprove within 5 days. Once open, those local and state officials have an obligation now to monitor and provide support, enforcement, technical assistance across the spectrum of support to enforce the guidance. This has been a big issue, and I want to just acknowledge this. And teachers, I think they deserve to hear folks in positions in the legislature and the executive branch acknowledge this very publicly, that there are some schools that have been open and remain open that are simply not having those guidelines be enforced, that are not getting the support that they deserve, but are also not operating as they should. And so it's an obligation with these new measures that we're more transparent, and also we're all more accountable across the spectrum of support, not just local, but at the state level as well. Counties also must have, and we can talk more about this, Dr. Galley can talk about some of the epidemiology around this and talk about the why, but we must have a 7-day average case rate of less than 28 cases per 100,000 per day to implement the plan. This is a nuance, but an important nuance, and we can talk about that later. But here are the 4 pillars that gird this strategy. This is our California Safe Schools for All plan. Funding, safety and mitigation efforts. I'll go through each one of these in detail. Hands-on oversight and assistance, and then again the issue of transparency and accountability that families deserve and our school staff deserves. Let's jump right into the funding. Here's the idea. We have been working, and I want to thank Senator Leyva, I want to thank Assemblymember O'Donnell in particular, who have been just spectacular partners in terms of engaging through the legislative frame in a very iterative process to help us develop the framework of this plan. And I want to make this crystal clear. This is an iterative process. This is what we're putting out, but we're going to work together. We're going to fill in the blanks. We're going to address some of the nuances, what's expressed, unexpressed, intended, unintended, all that we're going to advance and work through. And we're going to work together through a legislative process because we're proposing an early action legislative plan to provide an additional $2 billion of support to the schools. particularly those schools that wish to open early as February. It works out to about $450 per pupil, not insignificant when you consider that's more than all instructional materials and textbooks. More money, we provide even supplemental supports for people with special needs, et cetera. But that's the baseline. It's high, as much as $700, but baseline is $450 per pupil support. That's the $2 billion. Those funds will be weighted to schools, address the issues of disproportionate realities, the low-income families, English second learners, or English learners, and issues related to foster care, and those, again, disproportionately impacted by this pandemic. We're also working with our federal partners to get the costs associated with testing covered through our Medicaid system, Medi-Cal here in the state of California, and that's why you see that bullet point as a goal. And then we want to continue to leverage the dollars that I referenced a moment ago, that $5.3 billion in learning loss, the $1.47 that was direct from the federal government to our education system, to make sure that we continue to leverage those funds for support for a safe reopening of in-person instruction in the schools. I want to talk now about the safety and mitigation measures. That's the funding side, the $2+ billion. Now, on the safety and mitigation, here's the testing. We've listened to our teachers, our paraprofessionals, and others that want to see more testing. We all respect that. We want to see that as well. And so here's what we've worked out in terms of the guidelines, in terms of the framework. And you can see, based upon those tiers that we had established a number of months ago, we're looking forward, going back to the tier framework shortly as we work through this third phase or wave, and then get back away from these stay-at-home orders and begin anew with our purple, red, orange, and yellow framework. In that framework, you can see the requirements based upon the proposal as we are advancing it today of testing, symptomatic testing or asymptomatic, depending on where you are in that cohort. Asymptomatic testing in the purple cohorts, obviously the deep purple, as well as red, and then symptomatic once we start to see substantial reduction in community spread, substantial reduction in case rates and positivity rates. So that's the testing. Here's on the PPE side. We've done a master contract, which now we are turning over to others to reduce the costs and increase the volume and leverage our resources for PPE, particularly on masks. And so it's a requirement of that, and that work that was done to get that master contract done. All staff now are required to wear masks, but we want to go to the surgical mask level. We're requiring all students to wear masks, not at the surgical staff level, but that's the mark, at least for our staffs. And the schools are going to receive more surgical masks from the state, not just those 2 months of PPE, broadly defined, but more importantly, those supports will be provided, no cost going forward. More emphasis on contact tracing. We've talked a lot in the past about the partnerships with local health officers and our contact tracers, and turning over some of the deployment and the focus and the energy and the intention of engagement with the local health officers in our school. We're going to do more in that space. And then on vaccines, Today, the drafting guidelines work group, they're going to meet to finalize phase 1B. Remember, we're in phase 1A of our vaccination plan. Phase 1B moves beyond the cohort of healthcare workers and the cohort of those in congregate facilities, skilled nursing facilities, our seniors in those environments. The 1B phase includes our teachers as a priority. And today, that drafting guidelines work group, I don't want to preview, we'll see where they end up, but we anticipate that they will formally approve that plan. And that's good news in terms of the vaccinations and prioritizations, particularly to our teachers and others that are critical to help support a safe environment for our children and for themselves and their colleagues.